can really work together to enable those people to access.
Good morning, everyone. Sorry for the slight delay. I'm glad we finally made it. Thank you.
Hi, sorry for sorry for everything. We start now.
Okay, thank you. So thank you, everyone. That
He's the moderator, so you can present
Since you're speaking also, please can you just go to the front so that people will know?
So you have to be doing this, like send the link.
Please just go to the front so that.
So just put him on there. Is it
Yeah.
That's him. So you can just on the screen.
Technical support.
Hello, everyone. Can you hear me? Please, can you hear me? If you can hear me, let me know. We are a bit behind schedule.
We can hear you, and we're waiting for the technical system to start doing.
Okay, so I am I'm the coordinator, the session facilitator. So I don't know if there are people in the audience, but we could just start and just have the conversation starting right away. At least I have one of my speakers here. I'm still waiting for one more person, and we're going to just start the conversation. It's pretty much a very informal conversation around data sharing agency, making a case for data sharing. So as we welcome other participants and speakers, we would share different perspectives during these conversations, and we would
hear you. We can hear you, Ben.
Oh, you can you hear me now? You should be able to hear me, everything being equal.
No, we cannot hear you.
You cannot hear me. Okay. So let me try and see why. Yeah, Mike, someone else can hear me. So I want you to check your mic. If your speakers are okay, then you should be able to hear me. Who else can hear or cannot hear me in the room?
We can hear you.
Okay, thank you. I appreciate that. So this session pretty much is about creating awareness for multi-stakeholder in Africa health data governance to motivate patient-centric approaches in data sharing frameworks and policies, and to create cultural data literacy where we are aware and data speaks our language, and advanced conversation on multi-stakeholder data governance processes. Pretty much, it's a mouthful, but that's essentially what our conversation is going to be about. We haven't got so much time to dive into this conversation as deeply as we'd love to, but we just want to pitch another conversation beyond data privacy, beyond data protection, to also say that data in itself is useful when we share it, when we put it into context, when it's connected with other data points. That is when data become very useful and powerful. And the argument that I'm pushing, and a few others might share if they share the same opinion, is when we make data, all we are concerned around data is making it private or protecting it, we might be missing out on the value that data in itself offers us. Privacy, in one way or the other, is good when appropriately done. However, when it's the only purpose where every time you talk about data, it's about privacy, it's about protecting it. And for issues such as healthcare and digital health, what it offers us, if we can unleash the power of data, it requires that we have to allow it to interact, connect with other sources, connect it with context. And my data becomes very powerful when it's connected with your data, when your data is connected to mine, when we share it responsibly. I'm not arguing for making data available to all without any form of guardrails. I'm only saying that we should make data empowered for those who data are being collected from, especially data subjects. So those are my arguments right here this morning. And I just hope that we will find others to engage in this conversation so that we just don't keep data in silos and we don't keep data in just storehouses. Some disclaimers, I belong to different platforms, and one of them is Datasphere Initiative, where we believe so much in multi-stakeholder data governance beyond silo data protection frameworks. Dr. Lajide, you say you can't hear me. Please, you should be able to hear me, and I'm screaming here. So I've got a few speakers online to share some of their views as I ask some of these questions. And I've also got Nashilongo on site. So Nashilongo, thank you so much for stepping in since I couldn't make it to Lilongwe. By the way, a friend of mine told me Mulibwanji to everybody in Malawi. So that's my greeting for you. I hope I pronounced that well. With that said, I have Dr. Adebola here, one of my panelists, who will also share some of his experience or his perspective on health data governance, making a case for data sharing agency, because you cannot achieve proper data protection if people don't also have meaningful and responsible way of sharing data. And as far as I'm concerned, or what I've seen so far, there hasn't been a lot in that argument. I know there's open data, and I know some of our panelists will speak to that or believe in that, and we will hear that. So if you are part of the audience and you like to comment or interact, please feel free. I think the moderators on site will gladly do that. With that said, Dr. Ajibola is a digital entrepreneur. He's a medical doctor. He's a digital health advocate and pioneer in Nigeria and across Africa as well. So if you wouldn't mind, I would like him to unmute and share some of his perspective in regard to this conversation. And thereafter, I hope some of the panelists will also jump in and we can continue this conversation. We have very limited time to discuss it. And I hope there will be enough time to also get reactions from the floor. With that said, if I've not mentioned before, my name is Benjamin Akimoeje, and I am a PhD student at the Namibia University of Science and Technology. Thank you very much. Dr. Ajibola Olajide, can you speak or not? Dr. Ajibola, are you online? Can you connect? I can see you. Okay, while we wait for him, I don't know if Nashilongo as well can. Oh, okay. Okay, we just wait. I'll just wait. So, while we wait for Dr. Ajibola to, okay, he's unmuting. Okay. Dr. Ajibola was asking if you are ready to take the stage to speak to the topic we're discussing. Okay, so while we wait, okay, Wisdom is also here. Wisdom is also an internet governance practitioner. So he also believes in open data. So some of the questions that might help us to start this conversation is privacy as helpful to Africa health, digital health landscape as is being championed? With privacy on the front line, what chances do health data have to offer innovation to practitioners and innovation to the patients? And finally, who creates or develops some of the prominent privacy or data governance frameworks that we're running with across the continent? And then are there current data sharing practices or frameworks or even agencies that are on the continent, and how do they operate? These are some of the questions that any of the panelists can take on if they have gotten, digital platform has its challenges too when you are using online tools. So Wisdom, if you are available, you can take up the stage and share some of your experiences around data sharing as against overly prioritizing privacy and data protection for digital innovation.
Yeah, thank you very much, Benjamin. Am I the first speaker?
No, you are not the first speaker. I am the first speaker, and I've been speaking since. So this is a conversation. Yeah, thank you.
Okay, thank you very much. I'm just going to share Ghana example so that before I finish, the audience will understand what we meant by data availability and all that. Yes, my name is Wisdom Donkor. I'm the Research Foundation. Benjamin, am I on? Okay. So I started this data thing since 2011. And as at that time, there was this G8 summit that Obama spearheaded, and we have this initiative called the Open Government Partnership. I think that was when the open data, the whole of open data thing began. And then at that time, it was kind of a new thing to everyone. People begin to ask questions: what is open data? What is open data, and all that. And then we brought that to Ghana. Ghana signed on to that partnership, and then that is how Ghana began its process of opening up some data to the public. And then I have to admit that before we started, we had it very difficult. Even preaching the open data thing to government itself, and then to the public itself. We have a situation where even some of the directors, and then some of the ministers thought when we say open data, we are asking them to open up their data so that we come after them. So it took a bit of time for us to be able to kind of drive that message to everyone that no, we are not talking in terms of asking you to open up your data and then us coming after you. So that is how we began. And then I remember at that time, I was working with the US Open Data team and also the Indian Open Data team. So collaboratively, we were three: Ghana, US, and then India. So we were working on these open data processes, and then we had our first platforms, I think in 2012, mid-2012. So that is how we began the process. But then I have to also admit that we have a lot of challenges, and then I'm going to mention some of the challenges. Ben, if my time is up, just prompt me, and then I will stop and continue. There are challenges if we really want to address our data issue, especially within the health sector. Ghana might be on that path, but then there are many African countries that also need to come up to speed in terms of opening up their data. And when you take especially the health sector into consideration, this is a sector that we must be careful when we are talking about opening up data. Hence, we need to understand the principles of opening up a data, their principle governing that. And we also have data that can be made available to the public. And then there are certain data that cannot be made available to the public. I'll give an example. Using an administrative data. Administrative data are the data that are the day-to-day data that is being generated by our various government agencies and all that, even including the health sector. They also have an administrative data. But then there are certain kind of data that is classified as sensitive. And then in that sense, those data cannot be made available to the public. When you take, let's say, example, you have a patient who is sick of a particular disease, have gone to the hospital, they pick the data and everything. I mean, you know, that is, in that situation, the health service that is handling that person's data needs to be very careful how that person's data is being handled. And then that is where the data protection comes in, to protect certain those kind of data. But then when you talk about data on malaria, data on tuberculosis, and then data on other common diseases that can inform policy, those data can be made available to the public in a sense that developers can come and then use that data to actually help policymakers to address that problem. So if there's one particular village and always they are sick of a particular disease, those data can be made available, and then policy that will inform policy direction and all that. So that is that. And then another angle is that we are talking about e-health and all that. What do we mean by e-health? E-health basically is that if a patient happens to be in one location and then has relocated to another location, and then in a sense that the first location, there's maybe a health facility that has all this data about this person. Now the person moved to a far away location, and then the person want to access the health center or in that second location. So what happens? So if you have that e-health, it makes it very easier. That means the first hospital can share its data on the platform, and then when the patient goes to that second hospital, that second hospital will not have to go back again and then picking all the information about this person. So that is those are some of the things that we need to understand.
Yeah,
but then there are, yeah.
So thank you very much. I think we still have some time to discuss. I just want to get in the other panelists. I mean, you've made quite critical points. One of them is personal data should be shared carefully, whereas public health data, like aggregate data, can be easily made available to developers, and it can help influence and inform policy change and policy decisions. And
yes.
Yeah, these are very critical points.
I'll come in again.
What did you say? Sure. So thank you for also making, so thank you for also making case for open data in Ghana. And I'm glad that you guys are on that trajectory. So at this point, let me call on Dr. Adebola to also share his own perspective in terms of responsibly making data available and unlocking the value that data offers to the healthcare sector. Dr. Adebola, if you are available, please, can you just share your perspective with us on this issue that we are currently engaging? Dr. Adebola, are you there? You might be having some issues. Dr. Adebola, we cannot hear you. I guess you have a mute, but yet to hear your audio. So while we wait for, I can't hear you. I can't hear you. I don't know if anybody else can hear him. Currently, I cannot hear you. Your
No,
mic,
Ben, we cannot.
Your mic is not transmitting. It's gray out. While we try and resolve that, I think Nashilongo is on site. If she can step in while Dr. Adebola try to get his mic sorted. Okay, so he will rejoin. Nashilongo, can you try to go now? Nashilongo is on site, so she should help us with the face connection with the audience. Is that possible?
Thank you. Yes, okay. Thank you. Hi, Benji. Good to see you.
Same here.
Yes, and thank you for moderating this very important discussion on data health and mapping out the best possible ways for in Africa. So I want to quickly, Benji, if you allow me to just speak a bit on privacy in the Datasphere ecosystem, and then and then I will also just chat a bit on personal data and public data. All right. So in addressing the issue of privacy, particularly on public health data, I'm sure you remember a few years ago, and I think for a long time actually, a number of data leaks related to health, particularly those on HIV, has been making rounds, and I think this was also the same in Namibia, if you remember. In that case, perhaps that helps us contextualize privacy even much better. And that was, I think, before the viralization of the internet and making things popular and going viral. I particularly remember blood being dumped, I think, in one of the dumping sites, and that day, that blood was from patients, I think, who had donated blood, and that blood was negative, or was rather positive, tasted positive. And for those people who goes to the dumping sites for different reasons, I think the way the people who alerted the public and the media about, you know, how so-and-so, they know now that that person is HIV positive or also, right? And then we move into the COVID era, where we saw how issues of privacy or in coordination in sharing public health data sort of became very pivotal, and privacy in particular was to a certain extent protected, strengthened by all stakeholders that are involved, including, of course, the public health sector. So this is sort of the picture of the issue of privacy from the pre-digital era and the digital era, and that really just stipulates the importance of, now that we are in the digital era, there is possibly a need for us to be strengthening or to be making sure that personal data, particularly on health, is quite protected, and that becomes tricky for a lot of countries like ours. I heard like Tanzania, where there is no personal data protection. But of course, with the regulations and frameworks in place, that it can be sorted. So what does it then requires for privacy to be protected, to be so key in that case, Benji? And perhaps I would want to also hear from the room as the conversation happens and goes, as to who, you know, which stakeholder should be the best. There's a hand in the room, but let me just wrap up my point as to what stakeholder is most important to be held accountable in the protection of data in the area where there is no laws, but also where innovation, for instance, in the era of open data is key and is pivotal for us to move forward. Thank you, Benji. So there's a hand in the room, but I think Benji was also waiting.
Yes. So maybe we'll quickly take the question from the room with a minute or two, then we can quickly revert to Dr. Olajide, and I can react to some of the vital points, critical issues you have raised. And I thank you for your perspective on this point. Okay, so let's get the reaction from the room quickly.
Okay, thank you, everyone. Good morning. My name is Toba Albani. I'm the Vice President of NIRA, that's Nigerian Internet Registration Association in Nigeria. We're responsible for .ng CCTLD. To react to the comment raised, I would use the instance of Nigeria. Nigeria recently set up a policy similar to what the EU did with the GDPR, called the NDPR, with focus of protecting the data of Nigerians, personal data, because there's now a realization that personal data is now more important than ever before in the digital economy. And we cannot stop the fact, or we have to realize the reality that we will share data. We have to share data. Innovation will make us share data, but service providers need to understand the sensitivity of those data being shared and protect the interests of the citizens. So I think that first, government needs to put a lot of priority in protecting citizens' personal data. And what that automatically means is that service providers have a responsibility of protecting personal data of their users. For most of this Data Protection Act, you would realize that there's a responsibility of the service providers to audit, to secure, to encrypt personal data, and to get the consent of data subject before personal data is shared. Now, if we have that in place, what that means is that we can easily have things like, data sharing in health sector, which is super important, because once we have things like that, we'll see that healthcare becomes easier. You can easily change providers and move from one provider to the other. And it especially protects the interests of citizens as they transmit their data outside the geographical regions, because we realize that many Africans use the likes of AWS, Azure, and many service providers are not hosted locally. There has to be a responsibility of those service providers to protect the interests of Africans. So I think that government needs to pay a lot of attention in protection of personal data of citizens. And once that is done, service providers would then understand and take reasonable action. Since GDPR was released, you see that a lot of service providers had to start taking serious action because we realized, I don't know how many of us heard of the case of, for example, Facebook. There was a news that people's passwords were stored in plain text. People's actual passwords to very, very sensitive data was stored plain text. We know about the Cambridge Analytica scandal, right? It is clear that people's personal data need to be protected more by service providers, and it's government that would force that with regulation. Thank you very much.
Thank you, Toba, and I appreciate your intervention. And I know we're running down on time, and I'm just going to go to Dr. Olajide. However, just to quickly tip in, yes, no doubt, all you have said is very important. And also, as Nashinunga has said, the point is, does having personal protection laws and all of that, does it immediately imply that we're going to have data sharing? Now, what we're seeing is that people are using those laws to not share data. We might be missing out on the enormous value that data carry. And that's why we're saying that if so much attention is paid to privacy, knowing all of the things it protects us from, can we also create avenues for people to share data responsibly so that the value and enormous prosperity that data promises us can become a realization on the continent? That is the argument here. And I really appreciate your input. And I think we still need to continue this conversation. So Dr. Olajide, if you're available now, it's a good time for you to come in.
I hope you can hear me now.
Yes, we can hear you.
Okay, thank God the internet is stable. And like we do pray, I pray to be stable throughout the time I have to make my own contributions. Once again, I thank Benjamin and the co-organizers for this opportunity to talk on health data privacy in terms of policy. It cannot be over-debated, and a lot of emphasis have been laid on this subject matter not now, ever since the inception of provision of healthcare services. There are other data subjects that are available that people really don't bother about, which is also very significant. For instance, banking informations of customers and clients, and people at free will shares their banking details through their ATM cards over e-commerce websites. And nobody raised an eyebrows over that. But because of the sensitive nature, like the earlier speakers from the Nigerian Internet Group, the president has said, people are now being sensitive because of the high network and computing infrastructure available to easily share personal health information. I was able to listen to Wisdom. Thank you for your contribution. I missed that of Misu because of internet instability. But quickly, I would like to speak to awareness creation to promote multi-stakeholderism towards African health data governance. And to protect or not to protect who from who, or to protect what, to share or not to share. The value of sharing data is enormous from the point of care. If we go back to the point of care, there are a lot of solutions in the digital health ecosystem today that captures numerous patients' data. And this also includes in the wellness industry, whereby people move around with Google Feeds, Fitbits, and all of that for their wellness and fitness. So quite a number of personal data is generated on a daily amount. And all of these can provide insights into both curative, rehabilitative, as well as preventive medicine in the near future. In addition to that, we also have genomics that is growing rapidly and giving a lot of insights to the pharmaceuticals. Definitely, we have to share. But in sharing data, then there should be a policy around data usage as well as disclosure. As we have seen from Ghana and other countries like Nigeria with the NDPR, we already have some sort of legislation or policy guide to ensure that when data are shared, they are shared with consent. But there are times that you have implied consent, and there are times that these contents are overridden. For in the case of the COVID-19 pandemic, or in the case of any disease of outbreak. So no matter how sensitive personal health information is, without sharing it in the first place, healthcare services cannot be provided. Without sharing it, also, we cannot plan and resource and organize the health system such that we have a robust human resource for health in terms of training, production, and ongoing professional development, in terms of also financing for health needs, because you need to know the health needs of the population. So health data is very important. But before we start talking about should we protect or overprotect, or are we already overprotecting in terms of legislation and governance? Apart from NDPR, from the Nigerian experience, we also have other standardizations. We also have other policies from the Federal Ministry of Health, like the National Health Information Strategic Plan 2014-2018 is under review, that talks about how health data is being shared from the local government to the state government and then to the National Health Information Management System. Whether we like it or not, these data must be shared. But what is important in the digital health space is the fact that countries in Africa should adopt standards. Standardization is the first step into ensuring that our data are open and they are shared based on stakeholders' agreement. And that takes me to another point about motivating a patient-centric approach to data sharing. So if patients groups are involved in discussions around health data sharing, health data policy, the use and disclosures of health data, definitely we will have legislations and policy mechanism that doesn't stifle the use and sharing of those data. Without sharing those data in the first place, those data will not be useful for planning a national health system. So, but before governance and institutionalizing structures or strengthening existing health information system, digital health information system governance, first of all, we need to have standards with the collection of those data, because the leakage of the data or data thefts or identity theft starts with the standards for data exchange, for data collection. And in most African countries today, according to Adebesin et al., as far back as 2013, very few African countries participate in the standard development organizations that deals with the health domain. So moreover, we just go and mirror the policies for privacy, confidentialities of developed countries and adapt to our local context. No, we need more African upcoming generation in the ICT space, in the health space, our researchers to be involved more in the works of the ISO TC215, to be involved with level 7, to be involved with SNOMED CT, IHDSO, formerly now SNOMED CT, to be involved with digital imaging in communications and medicine, DICOM. That way leads to standardization of our data collecting tools in country. And that way, from the point of data collection to its storage, to its analysis, its reuse and sharing, it ensures that only those who will have access to those data will actually have access. For me, that is the starting point. Standardized data capturing tools and mechanism. That way, the end users or the consumers of health service knows that their health information are secured at the point of collection. Also, advocacy is very important as one of my recommendations. We need to advocate to patient communities, patient groups to participate in these ongoing discussions and processes. And that way they can be educated, because for most of our countries in Africa, we still lagging behind in terms of patient engagement, which is the consumeric health informatics. Most of our patients, even in the papered environment, don't know what their right is. Okay, so there's a lot of advocacy to involve patient groups to know how this data, then we can now start talking about there's overprotection, there's no protection, there's need for protection. But most importantly, this data must be shared for the usefulness of providing quality and affordable health services for our citizens in Africa. Thank you very much, Benjamin.
Thank you, Doctor. I knew I had come to the powerhouse. Thank you for sharing that, and I hope that would encourage everyone here. We have seen the different ways we can participate. I know there's a hand in the room. We're running out of time. We lost 20 minutes at the beginning. I know this, but this is a very vital conversation that is required, and we need to start having it. Data has to be shared. Oshoke Igono, if you want to say something, I think they won't kick us out if you quickly say it. And then, so he has called for our participation.
Okay, thank you.
Yes, go ahead.
Okay, thank you very much. So I just wanted to just share some comments. My name is Igono Oshoke, Program Manager of the Nigeria Internet Governance Forum. So I just wanted to share some comments about this topic here from a technical point of view. So firstly, I would like to just reiterate the fact that health data in general is personal data. So with this in mind, there are 3 things I just want to talk about very quickly. First thing, that there should be a clear difference between non-sensitive data in the health space, and there should also be frameworks to convert sensitive data to non-sensitive data with there's something in data analysis we call anonymity of data, where you can turn that sensitive data to non-sensitive to use for the betterness of the health sector. Then secondly, there should be strict innovation on secure data pipelines to share this sensitive data. And for this data nodes to be very, very, very important. Just like Dr. Adebola said, standardization of these data pipelines will make data very possible without having to convert it and without risking that sensitive data being out in the public. And finally, there should be investment in security operation centers in countries all around Africa. There should be investment in capacity building for cybersecurity professionals in the health sector, in hospitals.
So it's been a wonderful session having, okay. I can't hear you, so I'm sorry. So it's been an amazing time having this conversation. We thought 1 hour would be enough, but obviously we need to end now because there are other sections coming after. Nashilongo, thank you for being our hands and feet on site. Thank you for all the participants that showed interest. This conversation still continues. I will encourage everyone to go on Datasphere Initiative. It's really an interesting opportunity for us to call multi-stakeholder into the room and have conversations. I don't know if you have a passing word, a parting word, Nashilongo. You're on site, so you should have the privilege.
Thank you, Benji. So my parting words really in making a case for responsible data sharing is just riding on my colleagues that spoke earlier, the need for standardizing data collection tools to enable reusing and closing gaps in data innovation and service delivery, but also in creating frameworks in the absence of laws. Thank you. Oh, okay. Yes. So Benji, the parting words, and thank you. I think this is conversation, and like you've mentioned, this conversation happens within the Datasphere Initiative framework that is hosted by the INJ, the Internet and Jurisdiction, and our wonderful coordinator Trace is in the room as well. So please, they are busy with creating a number of tools for the African Union, and we'll be happy. They'll be happy, obviously, for you to be in part of those processes and add your very valuable contributions in making that tool effective and adaptable for the entire continent. Thank you, Benji, and thank you for hosting this. Thank you.
Thank you, Doc. We couldn't speak more. Thank you, said a lot. Wisdom, also thank you for showing up, and thank you everyone that participated. Natalia, thank you for showing up. I appreciate all of you. I miss Malawi. I hope another time we'll be able to do this again. Thank you, and let this community conversation continue, and let's not overemphasize privacy and miss out on innovation that data value offers us. That's the whole essence, and we also need to create our local
Benjamin
agenda. Yes,
Benjamin,
Wisdom.
tell them next they should open the Zoom 15 minutes before time. They shouldn't wait after before opening the Zoom. I mean, they've taken away.
Okay, I hear you. Bye, everybody. Thank you, Wisdom.
And that's not fair to the person.
Yes. Thank you. Bye. Thank you, Doc. It's great to see you. Thank you, Nashilongo. Bye. Bye to everyone there. Thank you.
But Benjamin, you should have kept talking.